Hello, everybody. Welcome to Birth Control Trends Tuesday. My name is Ananya, and I'm here with our CEO and co-founder of Pandia Health, Dr. Sophia Yen. Every Tuesday, Dr. Yen addresses popular birth control questions. Before we get started, make sure that if you already have an active prescription for birth control, sign up for free delivery and automatic refills of your birth control straight to your mailbox. If you need a new prescription and you're in California, Florida, Louisiana, or Texas, then you can sign up for an online doctor's consult with one of our expert doctors right here, and you can use referral code TRENDING so we know how you heard about us. Now, let's get into the topic for today. We are going to be discussing more of your frequently asked birth control questions, taken straight from Google. We're just going to be filling in the blanks. Does birth control do X, Y, or Z? So, to get started, Dr. Yen, one of our most frequently asked questions is, does birth control expire?
Yes, it absolutely expires. If there's an expiration date on it, I wouldn't use it. Though in general, with other drugs, you can let it expire, but it will lose efficacy. So the whole point of that date is after that date, it's not good anymore. It will have a lower efficacy. So the longer after the date, the higher your risk of getting pregnant, but possibly as soon as the expiration date, don't use it.
Got it. That's good to know. I always thought just because it's in a little cute package, I can just take it whenever I want. 2 years down the road, I find a package, I can just use it. But nope, not the case. Good to know. Number 2, does birth control work? How effective is it?
Yeah. So if you're on the birth control pill, patch, or ring, it's like 95 to 90% effective. And the part that it doesn't work is user error. So the problem with the pill is you have to remember every single day. With the patch, every single week. And then with the ring, once a month, or there's now a 1-year ring, which is once a year. But with the pill, 365 opportunities to mess up. With the patch, 52 opportunities to mess up. With the standard ring, 12 to 13 months in a year to mess up. And that absolutely works if you take it. However, most drugs, all drugs, were based on a 70-kilo male. And so anywhere you deviate from the quote standard, be it by ethnicity or be it by weight or be it by body, structure, I'm like heavier or I have more muscle or I have more fat or I have more whatever, then it's less likely to work. So women who have, or those with uteri who have a BMI of greater than 35, a lot of these methods will strongly recommend that you use a backup method. And again, I just like to put it out there as a feminist, as a person with a uterus, demand the condom. Because if you don't use a condom, then you're stuck with semen dripping for 24 hours. And that's gross. So it's not about, it is about preventing sexually transmitted infections. But it's about, I don't leave anything in your body that drips for 24 hours. Don't leave anything in my body that drips for 24 hours, Equality.
Yeah. Take control of your vagina, honestly. Yes. And so, yeah, that's a good point, is that there's so many different types of birth control. We've talked about that in previous lives as well. And Pandia Health does have some great blogs going into depth about the patch, the pill, the ring, all of the different even types of pills within that category that you can even potentially take. So yeah, it's always good to remember it's not just one blanket statement, oh, birth control. There's so many different types that we can really, at a place like Pandia, really specialize for your body and your needs. Always good to keep in mind. Next question. Does birth control make you gain or lose weight? Very common.
Yes. Yeah. So I can speak on the research side. On the research side, if you have 50 women on the birth control pill and 50 women on the birth control, not on birth control, the women not on birth control weigh on average a pound more than the women on birth control. And the reason why is when you're not on birth control, you bloat up and down, bloat up and down. And that bloat can be a pound to 4 pounds to 5 pounds. And so the women that are going up and down, up and down, up and down are up and down. Whereas the women on the birth control pill patch ring is just smooth. And so you don't lose a pound a week, a pound a month, a pound a day. You're just a pound less than your average woman who's up and down and up and down and up and down and bloating up and bloating down, thanks to her uncontrolled hormones. Whereas if you're on the pill patch ring for 3 weeks, you're smooth. And then that 1 week off, all bets are off. Again, we always want to, emphasize that each woman's different and that there are 40 different birth control pills with 7 to 8 different progesterones. And so different women respond differently to different progesterones. So if this progesterone gives you the munchies and makes you gain weight, there are 7 other ones you can try. And then some women respond to the estrogen. So there are 2 or 3 different doses of estrogen that we like to keep most people on 30 micrograms if you're under 30 for your bone health. And then once you're 30, we like to take you down to 20, or we'll let you hang until you're 40 and then take you down to 20, because at that age, you have an increased risk of blood clots from too much estrogen. So the research shows if you have 50 women on the pill, 50 women not on the pill, the women on the pill are 1 pound less. And so, but again, each woman's different. And some will get munchies, some will deal differently with the munchies. You know, if you deal with diet soda and sugar-free gum, you'll be okay. If you do like I do, chips, bread, crackers, a ton of carbs, you're not going to do so well. But I've been on the pill and have, you know, not gained anything more than the standard. And you also have to do that. A lot of women are going to college and they're gaining the freshman 15. A whole bunch of women right now are doing the COVID-19. Because we're sitting around eating crap, we're stressed out, we're watching TV, you know, we are getting a lot of sleep, which is good, but we're not exercising, we're not getting around. So you will gain 19 pounds, but it will not be from your birth control, but you may have just happened to start birth control because you found Pandia Health and then you started it. So you have to realize, compared to your average person, right? And it's unfair to judge birth control during the freshman 15. You have to check it with people who didn't take the pill, people who did, and the people who are on the pill average a pound less.
That's good to know. So it's just more level, more controlled all the way around. Awesome.
Smooth. I'm all about smooth as opposed to up and down and up and down and up and down.
Yeah, that's never fun to go up and down all the time. So we have a question.
What most women are doing.
Yeah, no. Come to Pandia Health if you want some stability in your life, honestly. So we have a comment. If I don't have insurance, what is the best form of birth control for me to use? So
with Pandia Health, our like 95% of the birth control pills are generic, and 95% of them you can get for $15 per pack. However, know that in every state, though some states are cooler and some states are not, California goes up to 200% of the federal poverty level. Other states may only be at 100% of the federal poverty level. If you fit in any of those, you can get free birth control. It's called Title 10 Family Planning. Google it. It's Title X. Title 10, it's a Roman numeral. And that's what you hear the Republicans constantly trying to cut. But if you are low income or you're a student, you make no money, though some students work hard and they make money to put themselves through school. But if you're like my family, we didn't work, we just stayed at home and studied like crazy, then you qualify based on your income for Title 10 family planning, because it's in the government's interest that if people don't want to be pregnant and they want to go get higher education, they want to work, they want to make money, that's better for the government than people that are being pregnant that don't want to be pregnant. And so know that if you have no money, go look for the Title 10 funding by the government, but also know that we have birth control pills at $15 per pack, 3-pack minimum. We charge $20 if you want 1 pack. So it's simply because shipping, handling, overhead, sending it to you, we'd much rather do it at 3 months rather than every single month. And then that comes out to 50 cents a day. So, you know, if you can forego 50 cents a day or, you know, $15 a month, that's how much it'll cost you. And we also have the Pandia Health Birth Control Fund. We've had a physician that's one of our members, Dr. Culver, donate funds towards that, as well as other anonymous donors and non-anonymous donors. If you go to pandiahealth.com/social good, on the bottom, if you got money to donate, donate. If you need birth control, please apply. And we are closing applications June 30th, and we do it quarterly, but I may push them to just do it on a rolling basis. But it depends how much money we have and how much bandwidth we have to give out the money and review all of the applications.
Yeah, I think it's great that Pandia Health has that social good part of it. We're working on it right now, and we're excited to look at everybody's applications and get you guys the funds that you need. So yeah, pandiahealth.com/social good, and you can either donate if you are able to. You can donate to our funds, and you can help people get the money that they need. Or if you need the money, you can apply there. It's super quick and easy. Awesome. So next question. Does birth control work immediately after I take it? If I have, let's say I have a hot date tonight and I'm thinking, oh, maybe I'm going to need it. Can I just take the birth control this morning and expect it to work tonight?
No. So birth control needs, in general, I'd say, 3 days to be on the safer side. And in general, I tell everybody a month. So technically, if you start the birth control pill, patch, or ring on your period, then it should be effective within 24 hours. But again, different body sizes take different times to achieve the steady state concentration that would truly protect you against the egg popping out or thinning out your lining. So I tell anybody, if you start on your birth control pill on your period, the theoretical is like 3 days, but I would give it a week. I always add more because I don't want anybody getting pregnant that doesn't want to get pregnant. And then I always say just a month. And then in general, as you heard me say, always use a condom. So just if you double up, you'll be totally good. But if you're only using one, then you risk sexually transmitted infections and you risk having sperm leak out for the next 24 hours and mixing up your vaginal flora. So please, at least give it a week to be absolutely safe, a month if you're really conservative. And ideally, forever should always use condoms if you're having heterosexual vaginal relations.
Okay, that's good to know. Does birth control work if I'm breastfeeding, if I just had a baby? Can I still take birth control? Is that okay for me to do?
So in general, we don't recommend any form of birth control that has estrogen. So the birth control pill, patch, and ring have estrogen, and we do not recommend that until about 6 weeks postpartum because you're already in a blood clotty way. You just gave birth and you could have lost a ton of blood. So your body's like clot, 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 clot. And then the estrogen is more clot. And so we don't want to add clot, clot, clot with more clot because then you get clot. So generally 6 weeks out. However, if you're breastfeeding, the estrogen can also interfere with the milk production. And so we ask you to wait until you're done breastfeeding. But you can certainly get the copper IUD immediately after or soon after giving birth, though they like to let the uterus heal, but there are people that do it right after. There's also the IUD with hormone, there's the implant, and there's the shot. All of the latter three are progesterone only, and those are okay after pregnancy. And they will work, but just know that a lot of people think natural fertility method, if you're breastfeeding every 2 to 3 hours exclusively, sure, if you're in a low income area, not like low income, but like third world where you're like starving and you're breastfeeding every 2 to 3 hours, then your body probably doesn't have the leftover energy to try to make another baby. But if you're in the United States, where a lot of us gain a ton of weight during our pregnancy, we have lots of extra fat and nutrition around, and we're not breastfeeding exclusively every 2 to 3 hours, then the breastfeeding as birth control doesn't work. And then know that the progesterone only pill, which we can offer you and that you can get, the joke in the medical community is, what do you call a woman on the progesterone only pill? You call her pregnant or you call her mama, because if you take it 3 hours late, you risk pregnancy. So if you take your progesterone only pill 3 hours late, you need some emergency contraception. And if you had sex in the past 5 days, or if you intend to have sex in the next 5 days, you need to use a backup method, aka condom, abstinence, masturbation, because it's not covering you. So the progesterone only pill requires you to be anally retentive. Whereas the birth control, the combination methods with estrogen and progesterone, you plus or minus 5 hours.
Okay, that's good to know too. So just to recap really quick, there is a lot of information about breastfeeding and birth control. We actually have a great blog about that topic exactly. If you go to pandiahealth.com/blogs, you'll find it there. A lot of information about what Dr. Yen just talked about birth control and breastfeeding and what you do after you have a baby and the progesterone only. So all of that information is there if you guys want to recap on that. But that's really good information to have as well. Our next question, let's look to the comments. If my period is irregular, when should I start my birth control? You just mentioned that you might want to start when you're on your period. Is that what I heard correctly? So yeah,
Yeah, I like to advise people to start on their period, but if you start, you can start any time. Just know that if you start in the middle of your cycle, or we don't know where you are in your cycle because your periods are irregular, that you are more likely to have breakthrough bleeding. And if you're using it for, skipping your periods completely, eventually you will have breakthrough bleeding. So it doesn't really matter. So you could just start it, and then when you have breakthrough bleeding, come off. But if you're using it for birth control, the question is, to cover you, we need like 3 weeks in a row of the medication before we come off. So if you break through bleed on that first week and you come off, then you're not covered for the future, which is fine. Again, use condoms and you won't have a problem. But if you don't want to use condoms, then, that might be an issue. But for me, I like the least amount of side effects possible. And I believe that if you start when the uterus has cleaned itself out, so don't start at the beginning of your period when blood, but like when it's all cleaned out and you're just on the drips and the dregs, then we can start and add the layer of birth control hormones that, that brings it on. But if you have polycystic ovarian syndrome, for example, then you can just start it and then know that you might get breakthrough bleeding, and you can come off whenever you have breakthrough bleeding and you're trying to skip periods, or then you can come off for 5 days. If you haven't had 3 weeks in a row of constant medication, then know that you aren't protected for these future days and you should use a backup. And then on day 6, stop for 5 days, have a bleed. On day 6, whether or not you're still bleeding, restart the medication. Only the active pills.
Got it. So we've talked a lot about backup methods, about using condoms, and another one of the question is, does birth control prevent STDs? So I know a lot of us, or at least what I thought when I started birth control is, oh, I'm on birth control now, like that's it, I don't need anything else. Is that the case?
Yeah. The only forms of birth control that prevent sexually transmitted infections is condoms, abstinence, and mutual masturbation. Anything with hormones in it, and the copper IUD and the diaphragm and the cervical cap and the sponge, none of those prevent sexually transmitted infections. So if you, my thing is just assume everyone has every disease under the sun. And the way I go there is what I call the sex tree. Here's you. And then here's 2 partners, right? And then one of them is a virgin. Draw a little halo on that. This person has 2 partners. And then this person has 2 partners. And this person has 2 partners. And this person has 2 partners, right? And imagine the 2 to the exponential is like 1084 or something horrible like that after there's 10 people in this chain. And if they didn't use a condom once with you, do you think maybe they didn't use a condom once with her? And if she didn't use a condom once with him, then maybe she didn't use a condom once with this person. And then if anywhere in this chain there's a rapist, then you have, introduced all this thing. And I tell those with penises out there that if those without penis or anybody that's sexually assaulted, it's going to take them 3 to 5 years possibly to open up to you about that. And if it's a one-night stand or you've only been in the relationship for a couple months, you may never know that you were exposed to rapist. And if nobody checked for those sexually transmitted infections, if that person never reported, or if the person that checked them didn't check all the diseases, they often don't check for herpes, and they definitely check for HIV, gonorrhea, chlamydia. But herpes is my little pet peeve, because if you do oral sex, then you just put this down there, and then you put that in you, then you just gave yourself herpes. And so whenever you do oral sex, I think everybody should be checked for herpes, but that would cost a lot of money to our healthcare system. But in the future, we should be able to get the test and costs down. And so then we can know who has herpes and therefore should really use something when they do oral sex.
Interesting. I didn't know you could get herpes by oral sex.
Oh,
is there other STDs you could get with oral sex too?
Yes. So the whole thing with HPV, I've seen the HPV activists actually die from, not the activists, but the people that are acting up is because their loved one died from oral cancer because he was really good at cunnilingus. And I was like, I'm really glad that he was really good at cunnilingus, but I'm really sad that he died from, it's not funny, from HPV, from oral pharyngeal cancer. But the important thing is you can also, so if you do oral sex, you can get gonorrhea. And gonorrhea could look like strep throat. But if you just gave oral sex and now you have a sore throat and nasty discharge, might be gonorrhea. And if the doctor doesn't know to test for gonorrhea, they only test for strep. And then they put it on a plate and they grow it a certain way, but it's not going to grow gonorrhea. Gonorrhea likes to be in a blood-enriched agar. It also likes to be in a low oxygen environment. Back in the old days when I was training, we would have to take the gonorrhea thing, put it on a blood agar plate, throw a match in the bottle and close it so that the match would eat up all the oxygen. And I loved, that was fun. That was like science, but that's how complicated it was back in the day to get a gonorrhea sample. And so if your doctor thinks it's strep throat, they're like, oh, it's not strep throat, it's just mono, and then it doesn't go away, then they got to think gonorrhea. But also that's an excuse or a reason why if you have a good academic trained physician, they should kick your parents out once you're 12 years old and ask if you're having oral, vaginal, or anal sex. Because if they don't ask about the oral sex, it won't be in their brain to check for gonorrhea. And you don't know. It's not your job. You're not a doctor. But sometimes we as women, we as those with uteruses, we in general need to educate ourselves because the doctor can't know everything. And it's nice, for people to learn and have that in the back of their mind as they are getting their health care, but also to share with others.
Yeah. No, it's always good to stay protected, definitely. So let's go to our next question. We have, does birth control work with antibiotics? Let's talk about that. I know we talked a little bit about like birth control and alcohol last week. But yeah, let's talk about antibiotics.
Yes. So the general rule of thumb we say is that if you're going on antibiotics, you should use a backup method. And again, if you're always using condoms, then it's nothing new and you're fine. But the reason why is there's actually very few drugs that have actually been proven to interfere with birth control, which I believe it's rifampin, which is only used for tuberculosis. So if you got tuberculosis and they put you on some drugs, yes, watch out. And then the other one is griseofulvin, which is for fungus, and usually fungus of the head. And unfortunately, African Americans are more susceptible to it than other ethnicities. I don't know why. And so those are the two high risk kind of antibiotics. But as I mentioned before, each person is different. And so if the antibiotics kill the bacteria in your abdomen, in your tummy, in your GI system, there's actually some enterohepatic, entero meaning your gut, hepatic meaning your liver, recirculation of the birth control hormones. And if they kill the bacteria, then this recirculation may not happen. And that we don't know, we haven't tested, we haven't studied. And so that could be a factor for birth control failing. So if you're on antibiotics, and I always forget because I put a lot of young people on antibiotics for their acne, then if you go on that, it may interfere with your birth control. The sign that it's interfering with your birth control is before you were fine, and now you're having breakthrough bleeding. Then it messed things up. But it may be unfortunate that the first way you find out that it's interfering is you get pregnant. And that we don't want. So if you're on antibiotics, again, better safe than sorry. Use a backup method. And yes, it can interfere with it. But technically, if you look at the research, only 2 antibiotics. But again, every person's different. And I'd rather be safe than pregnant.
Always better to be safe than sorry and use a backup method for sure. So let's go to another few questions about what birth control may cause. So does birth control cause cancer? Does it cause PCOS? We talked about PCOS last week, but maybe just a little bit deeper on what that is and whether birth control is related, and also diabetes.
Okay. So does birth control cause cancer? I don't believe it causes cancer, but it can increase your risk of cancer. But there are one cancer that it increases, which is breast cancer, and it increases your risk by 13 out of 100,000. So if you have 100,000 women and we give them birth control, 13 of them will get breast cancer. But it doesn't mean necessarily they'll die, but they may need to cut off their breast, or they may need radiation, or all sorts of horrible things. But I want to put this in perspective. If you drink 3 to 5 drinks, alcoholic drinks a week, your risk of breast cancer goes up by 22 out of 100,000. So let's say you drink half of that, then it would be 11 out of 100,000. So if you drink, 2.5 drinks or 1.5 drinks a week, then that is equal to your risk from the birth control pill. The other thing is that the birth control pill decreases your chance of ovarian cancer, decreases your chance of endometrial cancer, decreases your risk of colorectal cancer, decreases your risk of anemia, and increases your productivity and decreases landfill. So it is thought that the decrease in these three cancers is greater than the increase in cancer in breast cancer. So it's a risk-benefit ratio. Certainly, if you personally have breast cancer, talk to your doctor, because most likely no. But some breast cancers are hormone sensitive, so hell no. And then for those that are not, then maybe okay. So that is the cancer question. Polycystic ovarian syndrome. Birth control pills do not cause polycystic ovarian syndrome. In fact, birth control pills are the treatment for polycystic ovarian syndrome, one of several treatments. And the reason people might think polycystic ovarian syndrome is caused by birth control is they didn't have PCOS before they went on birth control, but then they gained the freshman 15, and then they gained the post-baby, 20, 30 pounds, and then they got polycystic ovarian syndrome. During this time, they were on the birth control pill, and then they came off, and then they had polycystic ovarian syndrome. Not because of the birth control pill, but because you gained weight during that time. If you had maintained your weight exactly the same and we put on birth control, you wouldn't have gotten polycystic ovarian syndrome. But as I mentioned, there are androgens in the birth control pill, and if it gives you the munchies, then it gave you the weight that made you get the PCOS. The way that the way that birth control pills treat PCOS is that in PCOS, your ovaries making extra male hormone. And the the birth control pills tell your body that you're pregnant and turn off all those hormones, don't do anything. And so that's the way the birth control pills kind of shut down the polycystic ovaries, the eggs that are trying to come out every month and trying to pop, and then they make cysts. And so they just shut that down, so there's no more cysts. The cysts that you have there, they won't necessarily make it go away, but they will prevent new cysts from coming, because it's like, well, she's pregnant. She doesn't need to do anything like that anymore. And so your body's like, oh, okay. And she's pregnant, so you don't have to make all these extra hormones, which polycystic ovarian syndrome does. And then the other thing is the progestin in the birth control pills causes the sex hormone binding globulin to go up. And so sex hormone binding globulin, it binds testosterone. So imagine this is testosterone. It sticks to it and it doesn't let it get out. And so then the circulating testosterone is lower because it's bound, because there's more of this binding globulin sucking down the testosterone, so you don't get hairy and you don't get acne. And that is the main kind of treatment of the birth control pill. For PCOS, we have a great blog on it. Google Pandia Health PCOS. I have a talk that I gave for Stanford on it. And the other treatment is metformin, which treats the metabolic cause or consequence of PCOS. And I would recommend, if you were my patient, to do both, not just the birth control, not just the metformin. And what's interesting, if you go to endocrinologists, they will push metformin. If you go to the birth control specialist or you go to an OB-GYN, they will push the birth control. And your person, a primary care provider as an adolescent young adult specialist, bring the two together. And also I just, I'm a physician that loves medications. And so I believe two is better than one, because one is treating this thing and one is treating this thing, and two should come together. Then, was there another thing that you asked about? Diabetes?
Yes, diabetes.
So PCOS is not in any literature, to my knowledge, related to diabetes. Again, I'm sorry, birth control pills. Birth control pills in no way is related to diabetes. PCOS is related to diabetes. And so what it may be is that the women on PCOS have a tendency towards diabetes, has obesity, as I kind of alluded to. 90% of PCOS have obesity, and people who are obese are at greater risk of diabetes. And people that are that have PCOS are often on birth control pills. So again, association doesn't mean causation. And the good example of that is a smoker in the old days used to have a lighter in their pocket. And every smoker had a lighter in their pocket. But was the lighter causing cancer of the lung? No. It was the smoking. And so most PCOS people will be on birth control. Most women, those with uteri who don't want to get pregnant, will be on birth control. Is it the birth control causing the diabetes? No. It's the weight gain, family history, or autoimmune disease if you got it when you were a kid. But it's not the birth control causing the diabetes. And again, there is the progesterone factor that might give you the munchies, that might tip you over. But again, each woman is different, and there are 8 different progesterones. Most women do fine.
Awesome. Yeah, that's all really good information. And I read that somewhere too, going back to what you were saying about birth control and breast cancer. I read that on Pandia's blog, that yes, it has 13 out of 100,000. But if you look at alcohol, drinking alcohol 3 to 5 times or 3 to 5 drinks per week is like 22 out of 100,000. So relatively, it's really not a huge risk. It's a much lower risk, in fact.
Yeah. No.
It does get outweighed by the endometrial and the ovarian cancer that you were mentioning as well. So really, there's no huge concerns there with birth control leading to any of these diseases. That's always really good to make sure people understand. And one last question. Let's go back to talking about sex. Does birth control change my libido, my sex drive? How is that going to have an effect on that stuff?
I think it is very important to know, again, that each person is different, right? The person who has more acne might have more testosterone, and more testosterone leads to a stronger sex drive. But also, each person responds differently. Some people, when they're stressed out, they like to use sex as a way to release. Some people, when they're stressed out, the last thing on their mind is sex. So those are, 2 different people, and they're going to be affected by hormones differently. And there actually hasn't been shown when we have Dr. Hansen, who is part of our team, covers Texas, but she's going to bring on menopause. And the research has not been correlated with your level of testosterone and your libido and your horniness. There's also psychosocial things like my husband is evil, my work is stressful, I don't have any time to have sex because my children might bust in on me all the time. So there's like all these other factors on it. Certainly, if you notice you had raging libido before and you went on the birth control pill and it went away, then again, remember, there are 40 different birth control pills, 7 other progesterones that you can try, and we can definitely play with it. The hard part is when a customer comes to me and they're like, I don't want acne and I want libido. And the problem is these 2 are the same hormone. So you can have one or the other, and I have to do like a fine balance, right? Because if you don't want acne, then your libido may go down. But if you're a horny 20-year-old, you may have enough horny in you to fight any kind of thing. Because I've been on birth control since I was 16 or maybe 20, and I had no libido problems. And I'm one that likes to have sex when I'm stressed. So that may be different for people who don't like to have sex when they're stressed. And then people go, well, the other libido thing that I think is that if you're on birth control, you're more likely to enjoy sex because you're not like, holy crap, I can get pregnant. If the condom pops, I'm literally screwed. But if you have condom and the birth control pill, you're good.
Yeah, it's one more situation where it's really important to consider there's so many different types of birth control, and really you can only get those answers if you come to a place like Pandia Health and you talk to someone like yourself and really find the balance that works best for you. So yeah, on that note, that was our last question for today. Thank you all again for joining us here. Again, every Tuesday we're here for Birth Control Trends Tuesday with Dr. Yen. And again, make sure to check out Pandia Health's birth control delivery services at pandiahealth.com. You can use this referral code and follow us on all of our social media to stay updated with what's going on. Thank you so much again for joining us, Dr. Yen.
Thank you so much. This is fun. And if anybody has any questions, hit us up on your social media and share us with all your friends. And now that it's summer, we're going to relaunch our time of month videos. So white dress, white shorts, swimming suit, not the time to get with blood. So Google Pandia Health, Tom, YouTube videos. I hope you like them because I think they're hilarious.
I think they're hilarious, and they're also so helpful, though.
Awesome. So please share with all your friends. Let's make this go viral. In a good way.
Thank you, guys. Thanks so much for watching. Thank you, Dr. Yen.
Thank you.